name's Phedra Dodds. I'm the consultant nurse for endoscopy and gastroenterology here at Powys Teaching Health Board. Gastroenterology is the care of people with problems in their tummies and intestines. Endoscopy is how we investigate some of those problems by passing a thin tube into either the mouth or the other end and having a look round and trying to identify the issues. This is one of our scopes here. This is a scope for the upper end, and we pass it through the mouth, down the gullet, into the tummy, and then we can assess any disease processes that are going on. We can also take samples through the end of the scope. It has a hole where we can pass instruments, and this is very useful for therapies and also for diagnosing problems. In February of this year, I was very fortunate to be able to go to Bangladesh to teach endoscopy skills to Dhaka Medical Centre. Bangladesh is a country that is improving. It is emerging from some quite difficult positions. Dhaka itself is one of the most crowded cities on the earth, but again, things are improving there. There were many differences in the facilities in Dhaka that I noticed from my facilities here. We're very lucky in Brecon in that we have a Jag Accredited endoscopy unit, which means it has been externally assessed by the experts in endoscopy in the UK, and we've been awarded the highest accreditation. In Dhaka, there were many differences, but the thing that was the same was that the nurses were friendly and caring and funny and engaging. The doctors were very committed to their patients. And they did try, with the equipment that they have, to provide the absolute best in healthcare that they can. Our job there was to encourage them in this and to provide extra equipment and extra training and skills so they can make the most of what they've got. The Nurses Conference concentrated on the patient at the centre of care. We talked about privacy, dignity, consent, as well as more practical application of the teaching methods that we were bringing with us. The nurses in Bangladesh are very few actually, and they don't have a lot of education. This was actually providing them with a theoretical and practical education they need to provide their patients with care and also to assist their doctors with the more complex procedures. Coming back to Powys, I think what this trip has done for me is to reignite my belief in the transformational effects of education for people, both for doctors and nurses. The whole reason for going on the trip was to deliver care to patients and methods to the doctors so that they can treat their patients more effectively. This was brought home by one of the doctors on the trip who started the charity that actually paid for us to go out there. His brother was very unwell in Bangladesh and was unable to access some of the treatments that we had. And so his care wasn't as good as he would have got here. The other point of the trip is that we should share our wonderful expertise, training and facilities with those people around the world who perhaps don't have as much as us. Coming back to Powys, what I've brought back is educational techniques for the nurses, training programs and a communication with the Dhaka Nursing School that I hope will be ongoing. I think this will benefit both us and Bangladesh in the future. The nursing culture in Bangladesh is changing, and I hope that this trip has been able to aid that. The nurses on the course are now recognised within their specialty of endoscopy nursing, and this can only be good for their patient care.